elbow pain. So very, very common with lifters. You get lateral and medial epicondylitis, or golfer's and tennis elbow. Golfer's elbow on the inside, tennis elbow on the outside. And these are essentially just overuse injuries. The reason that they are so common is that everything that you do in the gym involves gripping. And when you are gripping something, you're not just working those forearm flexors, which is then what feeds into that elbow pain here when they are overused every single day, but you've also got your forearm extensors here, or your finger extensors, which feed into the outside of the elbow. Now, whenever you contract your grip like this, these muscles have to contract to stop your wrist snapping over. So that's what keeps your wrist aligned. And as a result, it's very easy to overuse these and build up tendonitis or connective tissue related injuries with them. So in order to fix this, the first port of call is take out the exercises that are directly aggravating it. So if you've got golfer's elbow and you're doing something like barbell curls and your elbow is forced round into that supinated position, you will find these are often the things that cause the most pain. Likewise, doing things like an underhand grip pull-up. So first of all, we want to switch to things like hammer curls, where we're keeping our thumb upright, that elbow in a neutral position. It's going to put a lot less stress on that inside of the elbow, okay? Likewise, we need to then start to strengthen up those affected areas. So first thing we're going to do, and you're going to do this before your weight training sessions, is you are going to grip a broom handle. You can either use something like a frying pan if you don't have one of these. Now, the further towards the end you grip it, the more tension you're going to get. If your elbows are very inflamed, and this works for both golfers and tennis elbow, by the way, you might want to start towards the middle of the stick. Elbow stays fixed to the side, and you're going to very slowly rotate over, looking to control that stick slowly towards the floor, get a good stretch, and then very slowly back over to the other side. You can do sets of 10 on both sides if your both elbows are very, very sore. And this is basically going to help you slowly increase the load capacity of that inflamed area without making it worse. Once you've got it starting to tolerate some load, and this is a good way of warming up your elbows before you train, you can then start to directly load those tissues with some eccentrics. So if you put the bench on an incline like this, we're going to start off with the golfer's elbow issue here. I would use a relatively heavy dumbbell, heavier than what I've got here. You're going to use your other hand to bring it to the top of the rep, and then you're going to let it slowly eccentrically lengthen. Then you're going to pick it up with the other hand, slowly eccentrically lengthen. Likewise, for the tennis elbow variation, you're going to pick it up using your other hand and then slowly let it go back to the floor. And then as you're able to increase your tolerance to loading, you can then start to do full repetitions and return to full training.